Thank you, Victor. Good afternoon, everyone. My speech will be a little shorter than what we just endured, and not nearly as inspirational, I'm sure. A little over 4 years ago, I was driving to work when I felt some tightness behind my left shoulder blade. Didn't think much of it, but 36 hours later, I was in the ER with extreme pain and shortness of breath. In a little under a week, I was then diagnosed with a T-cell rich diffuse large B-cell lymphoma. So in under a week, I had gone from a seemingly healthy adult to a stage 4 cancer patient. Over the next 4 or 6 weeks, I went under testing. It's where I first discovered the Lymphoma Research Foundation. We all needed information on what lymphoma was, because if you're like me, you never had heard of it before. Their website had a well of information, and I soaked it up. At the end of October, I started 8 rounds of R-CHOP, along with 4 rounds of intrathecal methotrexate. And once treatment started, things began to calm down. I decided I wanted to give back to the lymphoma community. My caregiver and sister Becky discovered that LRF was having a 5K walk the following year in Philadelphia, so we decided to start a walk team. In April of 2012, I finished treatment and got a clean bill of health, and later we had the walk. And it was a great experience, bonding with so many survivors, and the LRF leadership made sure to come up and greet each individual team captain as well as their caregivers. In the ensuing 2 years, I've become more involved. I'm now part of the Northeast Regional Council. And I was approaching 3 years of remission when this past February, on what was supposed to be my last routine follow-up scan, one of my nodes had a slight uptick in size. We quickly scheduled a PET scan, which that node lit up like a Christmas tree along with 3 others. And I was immediately referred down to Dr. Henry Fung at Fox Chase and Temple Health. His suggested course of action was 2 rounds of rice chemo followed by an autologous stem cell transplant. It's pretty scary if you ever think about it. I listened intently, but I know that I couldn't quite absorb everything he was telling me at the time. And I couldn't even begin to think of any questions I had. Luckily for me, later that week he was speaking at an Ask the Doctor program sponsored by LRF, talking about transplant options. Any holes in information that I had were filled that night. It was also helpful to speak to others who were going through or considering going through the same process. And once again, LRF had armed me with the proper information as well as support. With Dr. Fung's guidance, my hospital started me on chemo in early April. Each round was 3.5 days and included 2 nights in the hospital. Any thoughts of it being like my previous experience were quickly squashed, though, as my blood counts immediately crashed. And repeated the process 2.5 weeks later, and followed that with a PET scan. That scan showed enough improvement that we began the stem cell transplant in earnest. Starting on May 19th, my stem cells were harvested over 2 days. I had 1 day off before I was admitted to the hospital and started 6 straight days of chemo. On May 28th, I celebrated my rebirth day as my stem cells were introduced into my system. It felt surprisingly good in spite of the melphalan blues. If you know what melphalan is, you'll know that it causes some serious GI tract issues. So here's the one piece of advice I can give you. If you're going in soon for a transplant, make sure you bring your own favorite brand of toilet paper with you. You'll be doing yourself a big favor. The expected bottoming out of blood counts began for me on day +4. I also experienced a bad fever and low blood pressure, but thanks to the protocols put in place, that was quickly caught and put under control the next day. Exactly 1 week later, I was released from the hospital on day +12. Over the next few weeks, my blood counts continued to improve and stabilize. 60 days after I was in the hospital, I was back at work. Here I am now 123 days post-transplant, strong and healthy. Thanks to following my release instructions, my awesome caregiver sister who made sure I followed those instructions, a strong will, and of course the excellent care of the nurses, PAs, and doctors at Fox Chase, I was back up and running much faster than I had any right to expect. You need to know that a transplant is only a bump in the road. You can and will get better day by day. Over the past 4 years, I've never had that woe is me moment, but I certainly understand why someone would. I believe that an upbeat and positive approach would and did speed my recovery in all phases. Also being armed with the information that LRFs provided me with. If you are in need of support, I urge you to call the Lymphoma helpline provided by LRF. It will hook you up with peer-to-peer support that you so desperately need. I decided to pay my good fortune forward. If I can make a difference so that even one person gets the support they need, has a less arduous journey due to treatment advances, or then our lifetime cure is found, that's mission accomplished. I also urge those of you who are able to continue to support LRF, whether it's financially, by becoming an advocate, by becoming an ambassador, or by volunteering at a local event. As you can see, they're all vital to a patient's survival and eventually ending this disease. I'm now a 2-time survivor, and that's my story.